Bipolar disorder is a mental health condition that affects millions of people worldwide. It is characterized by episodes of mania, depression, or a combination of both. People with bipolar disorder can experience extreme mood swings that can impact their daily life, relationships, and work. Fortunately, there are several drugs available that can help manage the symptoms of bipolar disorder. Here are the top 10 drugs used to treat bipolar disorders in the US. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Lithium. Lithium is a medication that has been used for many years to help manage the symptoms of bipolar disorder. Bipolar disorder is a mental health condition that causes intense mood swings, including episodes of mania and depression. Lithium is classified as a mood stabilizer, which means that it can help regulate and stabilize a person's mood. By altering the levels of these chemicals, lithium helps reduce the intensity and frequency of manic and depressive episodes. It can also prevent future episodes from occurring. This can be a significant relief for people with bipolar disorder, as the condition may be very disruptive to their daily lives. Valproic acid. Valproic acid is a drug used to treat bipolar disorder that acts as a mood stabilizer. It works by increasing the levels of a neurotransmitter called GABA, or gamma-aminobutyric acid, in the brain. GABA is a neurotransmitter that plays a crucial role in calming the brain and reducing anxiety. In people with bipolar disorder, the levels of GABA can be low, leading to heightened anxiety and mood stability. By increasing the levels of GABA in the brain, valproic acid can help calm the brain and prevent manic and depressive episodes. This is because GABA inhibits the activity of certain neurons in the brain, leading to a reduction in overall brain activity. This can help regulate mood, reduce anxiety, and prevent extreme highs and lows associated with bipolar disorder. Lamotrigine. Lamotrigine is a medication that is commonly used to treat bipolar disorder. It is classified as an anticonvulsant, which means it is primarily used to treat seizures. However, it has also been found to be effective in treating bipolar disorder, particularly in preventing depressive episodes and reducing the severity of manic episodes. The way that lamotrigine works is by regulating the levels of glutamate in the brain. Glutamate is a neurotransmitter, which is a chemical that transmits signals between neurons in the brain. Glutamate plays a key role in mood regulation and is involved in several other functions such as learning and memory. Carbamazepine. Carbamazepine is a type of medicine that helps people with bipolar disorder. This medicine is normally used to treat something called seizures, which is when your body shakes and you lose control of your muscles. It can also help people with bipolar disorder. Carbamazepine works by helping to keep the brain chemicals in balance. These brain chemicals are called neurotransmitters, and they are like tiny messengers that help the different parts of the brain communicate with each other. Carbamazepine helps to regulate these messengers so that they work properly and keep the mood more stable. Quetiapine. Quetiapine is a medication that falls under the category of atypical antipsychotic drugs, which are used to treat various mental health conditions. Specifically, it is used to manage the symptoms of bipolar disorder, such as mania and depression. The way that quetiapine works is by blocking the effects of certain neurotransmitters in the brain, including dopamine and serotonin. These neurotransmitters are chemical messengers that transmit signals between neurons in the brain, and they are involved in regulating mood, among other things. In bipolar disorder, there is an imbalance in the levels of their neurotransmitters, which can lead to episodes of mania and depression. Olanzapine. Olanzapine is a medication used to treat bipolar disorder, a mental health condition that is characterized by mood swings that range from mania to depression. Olanzapine falls into the category of atypical antipsychotic drugs, which means that it is used to treat symptoms of psychosis, such as hallucination and delusions. But it's also used to treat mood disorders like bipolar disorder. It's important to note that while olanzapine can be effective in treating bipolar disorder, it does come with potential side effects. Some common side effects of olanzapine include weight gain, drowsiness, and constipation. As with any medication, it's important to discuss the potential benefits and risks with a healthcare provider before starting treatment. Risperidone. Risperidone is a medication that belongs to a class of drugs called atypical antipsychotics, which are primarily used to treat mental health disorders like bipolar disorder and schizophrenia. Risperidone is prescribed to help reduce the symptoms of both manic and depressive episodes in people with bipolar disorder. The drug works by blocking the effects of certain neurotransmitters in the brain, including dopamine and serotonin. These neurotransmitters are responsible for regulating mood, emotions, and other brain functions. By blocking their effects, risperidone helps to regulate the levels of these neurotransmitters, which can lead to a reduction in the symptoms of bipolar disorder. Aripiprazole. Aripiprazole is a medication that is commonly used to manage the symptoms of bipolar disorder. It is classified as an atypical antipsychotic drug, which means that it works by affecting the levels of certain neurotransmitters in the brain. Neurotransmitters are chemicals that help transmit messages between nerve cells and play a crucial role in regulating mood, behavior, and other bodily functions. Overall, aripiprazole is an effective medication for managing the symptoms of bipolar disorder, and its mechanism of action provides insight into how imbalances in neurotransmitters can contribute to the development of this condition. Diazepam. Diazepam is a type of medication that belongs to a class of drugs called benzodiazepines. It is commonly used to treat anxiety and insomnia in people with bipolar disorder, a condition that causes extreme mood swings between episodes of mania and depression. Additionally, diazepam can also help reduce the symptoms of manic episodes, which are characterized by periods of elevated or irritable mood, increased energy, and reckless behavior. For example, imagine a person with bipolar disorder who is experiencing a manic episode. They may feel excessively energized, restless, and irritable, making it difficult to sleep or relax. They may also experience racing thoughts, impulsive behavior, and difficulty focusing. In this case, a healthcare provider may prescribe diazepam to help calm their symptoms and promote relaxation. The medication would work by increasing GABA levels in the brain, which can help to reduce overactivity and promote a sense of calm. Over time, the person may begin to feel more relaxed and able to manage their symptoms, allowing them to function more effectively in their daily life. Clonazepam. Clonazepam is a type of medication that belongs to a group of drugs called benzodiazepines. These drugs are used to treat a variety of conditions, including anxiety and insomnia. Clonazepam works by enhancing the effects of a neurotransmitter in the brain called gamma-aminobutyric acid, or GABA, which has a calming effect on the nervous system. For example, let's say someone is experiencing anxiety and insomnia due to a stressful situation, such as a work deadline or a family conflict. They may be having difficulty falling asleep at night and feel constantly worried or anxious throughout the day. A doctor may prescribe clonazepam to help alleviate these symptoms. The medication can help calm the person's nerves and promote relaxation, making it easier for them to fall asleep at night and manage their anxiety during the day. With proper use and under the guidance of a healthcare provider, clonazepam can be an effective tool for managing anxiety and insomnia. Bipolar disorder is a complex mental health condition that requires a multidisciplinary approach to treatment. Medication can be an effective tool in managing the symptoms of bipolar disorder, but it is important to work closely with a healthcare provider to find the right medication and dosage. Additionally, psychotherapy and lifestyle changes can also play an important role in managing the condition. If you or someone you know is struggling with bipolar disorder, it is important to seek help from a healthcare provider as soon as possible. And if you're new here, hello and welcome to Medication Updates Quick Facts. Our channel's focus on health and wellness topics is driven by the increasing awareness and importance of maintaining good health in our fast-paced and often stressful lives. If this is something you're into, consider hitting the subscribe button and ring the bell icon so you can be updated on our next upload. Thanks for watching.